nursing student checking off Blair today on medication administration. And the scenario this week is Frazier Styles is a 29-year-old male with an admitting diagnosis of hypertensive crisis. He has a past medical history of hypertension and asthma. His most recent vital signs are a temperature of 98.7 degrees Fahrenheit, heart rate of 52, respirations 18, and blood pressure of 120/79. O2 saturation of 91% on 4 liters via an oximeter. His current medication orders are for atenolol 25 milligrams by mouth, NitroPace 1 inch topical, and Arabid 1 milligram 2 inhalations.
Okay. Alright, hi sir, can you verify your name and date of birth for me? Okay, I'm just going to take a look. Alright, sounds good. And I'm also going to check and scan. Okay, that looks good. And first I'm just going to check the medication orders. Atenolol 25 milligrams, NitroPace 1 inch, Arabid 1 milligrams 2 inhalations. So I'll come up here and get my medication set up. And I'm checking it to make sure it's right with the medication sheet, and it is. And so now I have my Arabid and my atenolol. But first, what I'm going to do is check and make sure this matches up. Okay, it does. And then before I give it to him, I'm going to scan to make sure it comes up right. And it did. And then I'm going to give this to him first. Okay, so what you're going to do is, well, actually, let me just verbalize. Okay, so what I would do is, if he needed help, I would assist him. I'd tell him to purse his lips, and I would help him push down, and he would inhale and hold for 10 seconds, and then let out. And then you would do it twice, since it's 2 inhalations. And then after you would do that, I would also check the atenolol, 25 milligrams, and I'm looking, and it matches up with the med sheet. And then I would scan them one at a time, because if you scan them all at once and then you have an emergency, it's already been scanned, but you didn't do it. So, yeah, so I checked to make sure that's right, and that's my second time checking it. And so I'm also going to scan it too before I give it to him. And then I would give this to him, and it was by mouth. And then last I would do the NitroPace. I thought it would be good to give it to him last, since this is kind of like a really effective drug, and if there was an irritation, it could be some increasingly high effects of this drug. So I would take the nitro pad, or the paste, and I'd squirt it on there 1 inch, because that was what the doctor ordered. And then, oh, but before I did any of this, I would put on clean gloves to protect myself from the nitroglycerin. And then I would put my name, date, and then time on here so that they can tell when I put the patch on. Okay, so I have gloves on, I'm protected, I have the name and date and time on here, and so squirt it to 1 inch. And so I was going to take it, I'm going to look, and if he was a man and he didn't have already a patch, I would shave his chest to avoid any irritation, and if it was already a patch there, I would remove it. And then I'm going to stick it on, and I'm going to avoid moving around just so I won't change the effects of the nitroglycerin. Okay. Oh, geez. But before I did that, I needed to scan a 3rd time with the nitroglycerin. I would scan here, scan there, then get everything set up, and then scan him. Yeah, okay. And, okay, so I have my patient set up, and I'm just going to go over the 6 red rules. It's have the right dose, documentation, patient, drug, time, and route. And those are 6 red rules that we always need to remember. And I believe that is